in his drive to cut bureaucracy and direct more money to the front line of public services. Speaking in Hull this morning, he defended his decision.
I'm bringing management of the NHS back into democratic control by abolishing the arm's-length body NHS England. That will put the NHS back at the heart of government where it belongs, freeing it to focus on patients, less bureaucracy, with more money for nurses, an NHS refocused on cutting waiting times at your hospital.
Well, I've been speaking to Dr. Sean Phillips, the head of health and social care at Policy Exchange. He told me what impact he hoped this decision would have on the management of the health service.
Well, first and foremost, that principle that the Prime Minister outlined today and that recognition that fundamentally the National Health Service, the way we deliver healthcare, is fundamentally political, and therefore ultimately the buck stops with our elected politicians, with ministers, in terms of the performance of the service, is very, very important. And increasingly it was the case. The principle as to why NHS England was set up in the first place, that you would create a distancing mechanism, that you would attempt to free the NHS from day-to-day political control, whilst well-meaning, was ultimately folly. And actually this is merely a recognition that quite fundamentally it's a political system, and it's vital that politicians ultimately do have control for it. And that recognition, as you say, is something which is recognised across parties. So the government are to be commended for being bold and taking this action today. It's something that Policy Exchange have called for a number of years. In 2022, when we looked at the significant headcount increases at both the Department of Health and Social Care and NHS England, which put over 20,000 between both those organisations, even with the trim that was made under Steve Barclay's tenure as Health Secretary, it was still the case that the department ultimately became unable to scrutinise the work in policy terms, strategy terms, that was happening at NHS England.
You say that in principle, it was well-meaning, but the folly was in the execution. Was it that the people working for NHS England went rogue? What was it exactly they did wrong?
Well, it was ultimately at that point that the levers at the political level loosened over time. There was a sense that actually the policy making, the direction of travel was being set within an arm's length body, and actually it needed to sit far more closely, far more tightly to the Secretary of State, who ultimately were the ones who the public hold accountable for the performance of the NHS, and that is fundamentally the recognition that the Health Secretary has made. It spoke volumes that when Wes Streeting entered the department in the summer, he said that the department and NHS England need to work as one team. There was talk that they didn't want to see another top-down reorganisation as recently as September as a result of the Darzi review. But over recent months, it's become clear to them actually that a middle ground was going to create even greater uncertainty, and actually that they had to take this decision if they fundamentally wanted to reshape the centre and take things in the direction as they look to deliver upon their mission for healthcare, as they put it.
Yeah, I'm just thinking about the range of trusts that we have at the regional and the local level: acute trust, mental health trust, specialist trust, community trust, ambulance trust, foundation trust. I mean, the list goes on. If they're to be set free to innovate, as Wes Streeting says, that's what he says he hopes, what do you expect them to do differently, particularly about the things we care about, like waiting times, priorities for cancer treatment, waste?
This is an exceptionally good question. And of course, one of the big unanswered questions is, and one of the criticisms you might well make of the announcement today, is that we don't yet have that clarity over fundamentally what the theory of change is, what actually the expectation is around what it is that the centre does, as in what the Department of Health and Social Care does, and then actually what they don't do, quite frankly, where there will be greater expectations, ability for providers, as you say, all those different healthcare organisations, whether they're the Foundation Trust, Mental Health Trust, Community Trust, etc., where they will have greater autonomy, ability to set their own priorities, and to be able to innovate. And one of the things that's really palpable, and something which we found in a report that we put out last year entitled Just About Managing, there's almost every NHS manager we spoke of felt, quite frankly, suffocated by a number of targets, a number of asks for information, assurance that were coming from above, the pressure from above, as it were. And so actually it would be no bad thing if you are able to free people, as it were, of those asks. But what will be absolutely critical in the way that you infer is that there's very, very clear prioritisation at a national level. To some extent, we do get that. So the government last month published their mandate. This is effectively the marching orders that in legislation is set out to the NHS. And those priorities are really clear. It is reducing waiting times for planned care. It is sorting out emergency care. It is improving access for general practice and sorting out the operating model. And fundamentally, if you think about the Prime Minister's plans for change, waiting times is the big political deliverable that they are going to be looking to shift the dial and make a difference on. And so there's a tighter set of priorities there, but the question will be how much freedom and ability is there for local NHS providers to be able to make their own decisions, ultimately to think about how they use their own capital budgets, or actually is this very much going to be a case of the centre really taking control and actually there being an even firmer grip. So this question around how tightly versus how loose the government are going to ultimately, what the position is going to be, is very much still up for grabs.
So that was Dr. Sean Phillips, who is Head of Health and Social Care at the right-leaning Policy Exchange think tank. What did you make of that? Do you think this is